Here is your question. Okay, so if you have read and understood, considering it critical care scenario, kindly tell me how would you manage this patient?
I will manage this patient according to the ALS protocol.
Okay,
uh,
ALS. All right, yes.
advanced advanced normalized protocol. I will first of all secure the cervical spine with the help of hard collar and sandbags and tapes. And then at the side, I will also look out for the airways in this patient. And in the airways, I will look the patient is if the patient is not able to breathe, I mean not able to talk, and I will look out for any facial injuries, mandibular injuries, and look inside the mouth with the help of jaws first. And if there is a fluid present, another reception with the help of reception. And if any foreign bodies or any tooth broken tooth present, I will remove with the this forceps.
Yes.
And then I will also search for any accessory that the patient is using. Search for the sounds the patient is making, like spider or any uh, uh, grunting sounds. I will also search that. And and breathing part, I will check for, and if the patient is requiring nasopharyngeal airway or the
Okay.
tracheostomy or
Uh,
endotracheal intubation.
yes. With the first airway, what is something that you're missing?
Uh,
Airway
First of all,
part, yes.
in airway path, I will first listen
All the
whether
things that you have told, something else you have
yeah,
missed. In ALS, when you're doing, before moving on to breathing, you have to make sure something. Here in the
yes, the
question, it
patient
says
is
cervical
fine. Yes,
spine injury. How would you rule that out, please?
I will check. I will assess. I will use the hard collar and I will fix it with the sandbag and tapes.
Yes.
And then I will consider using the job search maneuver to look inside the mouth, or I will insert the oropharyngeal airway, or
Yes.
other options to secure the airway are nasopharyngeal airways.
Okay.
And
Moving on to the breathing, because patient is having evitable breathing difficulty and unstable vitals, how would you make sure, or how would you rule out
uh,
the breathing on
the
inspection,
patient, first of all, I will
palpation,
look.
and yes,
Yes, I will on inspection. I will look out for any trachea. Whether on looking, there is a bilateral chest wall movement, whether it is equal expansion or present on bilateral chest wall.
yes,
And then I will also feel for the trachea, whether it is central or not. And I will also measure the respiratory rate of the patient.
yes,
And then I will percuss, and I will feel for the any crepitus or any surgical emphysema. And if
yes,
there is any open wound, I will use dressings to occlude the wound. And if there is I will do percussion to look out for any dull or hyper resonant note
okay,
and auscultate. as well as
Which
auscultate. So,
imaging would you do to confirm your diagnosis?
I will use this chest X-ray,
Yes,
posterior anterior view, PA view,
yes,
as well as AP view, as well as AP view.
yes. Okay, this image was also done. Can you read the image? What kind of image is it?
This is a cervical spine
Yes,
X-rays showing the structure of the cervical spine of the body,
yes, yes.
and there is a compression of the spinal cord,
Yeah, good.
cervical spinal cord.
How would you manage the patient now?
Yes, I will. First of all, you secure the airways of this patient after
Yes,
securing the cervical spine.
yes,
And then the patient may have the broken, if there is a broken ribs, the patient may be having pneumothorax
yes,
or hemothorax.
yes.
Then I will insert the, first of all, white board, this canal in the second intercostal space in the mid-clavicular line, and then later on a tracheostomy in the fifth intercostal space, mid-axillary line.
Okay. What is the ideal situation where you have to insert?
It is the fifth intercostal space,
Okay.
mid-clavicular line,
Yes. And
mid-axillary line, sorry, mid-axillary line.
now you are correcting. Okay. Right. Then what would you do?
Then I will assess the circulation of this patient. In circulation, I will measure the blood pressure, pulse, and then I will insert the catheter to look out for the urine output, and uh, then after then I will insert the whiteboard cannulas into two cubital bilateral cubital fossas, and
Okay.
resuscitate with the crystal alert, and I will send samples for full blood count, urea electrolytes, and
Right.
blood sugars, as well as ABGs, and one more thing that was as well as cross-match the blood
All right.
and say for 60 blood.
Considering
Yes.
the hemorrhagic shock which patient has undergone, how would you classify it? In which category do you think this patient falls?
And this patient is vitals are not mentioned. The patient is having,
They are mentioned. They are unstable vitals.
yes, if the vitals are unstable, I think it's a category 4,
3 to 4.
category 3,
Always
3,
give
3 to 4.
range. Always give range. That's what I've always told you. Okay. Right.
Yeah. Category 3 or category 4, the patient might fall into this category.
Yes. Okay.
And then,
What
yes,
might have caused such a drop in blood pressure or the vitals? What is something else
there is
that you should rule out? Okay, this was done in primary survey. What about in the secondary survey? What investigations would you or plan to carry out?
first of all, foot fracture is also right, foot fracture.
Foot fracture is
This
there,
needs to be caused.
clavicle and foot
Yes, this
fracture.
also
So how much blood patient might have lost?
around 1 liter of blood can be lost. These are the small bones, approximate 1
The
to
ribs
1.5 liter.
fracture as well. Okay.
Yes,
Yes. And how
polytrauma,
much
multiple
do
bone
you think
fractures.
the respiratory rate would be?
It, it would be in the range of like 30 to 40,
Yeah.
or more than 40.
Yeah. Okay. What else? What else would you rule out? What else would you do? If you can quickly
Uh,
tell me, if a patient
I,
comes with
yes,
the trauma, yes,
yes. I will do a fast in the abdomen, fast to look out for any other
fast
intra-abdominal
scan,
injuries.
yes. To rule
This
out
that
what?
is,
Fast scan you'll be doing to
I,
rule out
I,
what?
I, I will look out the four spaces like pericardial space and the Morrison space to look out for the phatic injuries, and perisplenic to look out for the splenic injuries, and this pelvis to see the fluid collection inside the blood.
Okay. Which, all right, you have met, all right. Which organ injury is most likely to cause unstable vitals? Just suppose you
Liver
do the
injury is
first survey and you find out that patient has liver tear. How would you manage that?
first of all, I will manage the patient according to the ABC ATLS protocol, ABC and the E protocol, and then on
What are you
moving on to
managing? Liver tear, managing with
yes,
ABCD protocol?
yes.
Okay.
So in just in abdominal, I will send all the blood investigations in circulation part. I will monitor the vitals. I will shift the patient into the IC. It will need to be transferred into the ICU, and I will uh, insert the center line. CVP monitoring, start resuscitation as patient may require blood transfusion in this patient,
Right,
and monitoring the urine output as well. And if
right.
the moving on to the treatment, if the
How
patient can
much
be further classified if the
resuscitation
patient's
fluid would you
vitals.
how much resuscitation fluid would you give to the patient initially?
Uh, uh, 20 ml per minute. We'll start with the 1.5 liter uh, of
Which
fluids.
which fluid, please?
I
What
will
type of
choose the
fluid?
ringer RL, wrinkle
Yes,
guided
yes.
lactates.
Okay. And you said you'll be needing blood transfusion. How much or how many units would you arrange or would you
Um,
ask for?
I will I will arrange it for 4 units of blood.
In order to monitor the response of the patient, what would you monitor or what would you look for?
Yes. I will look out for the capillary refill time and blood pressure as well as pulse of the patient, and I will insert the urinary catheter to monitor the urine output as well as the mental status of the patient.
Yeah. All right. Okay. Right. Thank you.
And more moving on to this treatment part. These are divided into two parts. Conservative we have done.
Yeah,
If the
this
patient,
this
yes,
is what I
in
wanted you to tell me because if you
yes,
suspect in like in the stem they say that CT scan was done, but like CT scan is not an ideal investigation to do if you suspect
yes,
liver laceration or liver tear. So you
yes.
answered it correctly. You'll
So
go for the fast scan
then
because
we
it's
will
a polytrauma case. So if you suspect that
grade.
there is
If,
liver tear,
if it is a
yes.
high grade injury, a high grade injury means grade 4 or grade 5 injuries, which are not managed, which are not usually managed conservatively. We will plan surgical treatment of this intervention. The patient
Okay,
may require surgical intervention.
sorry, here. This is enough for you to tell that you'll not go for the conservative management. Vitals
Right.
are
Yes,
not
ma'am. Yes.
stable. Okay, so
Yes.
here is the answer. Even if it's a liver injury, so it's not that kind of minute injury that can be managed grade 1 or grade 2. Even grade 3 can be okay, managed conservative,
Yes.
but this is not grade 1 or 2 that would be managed with the conservative management. So once you are telling me that you'll arrange for the blood transfusion and all that, then you have to inform the operation theater, you inform the anesthetics, and there will be surgical management in order to stabilize the vitals. So
Yes.
that is the only way. You'll open it and then you'll do the perihepatic packaging or you'll repair the resection, whatever. So that cannot be
Yes.
done without opening it. So
Damage control
that will be
procedure. Very good.
laparotomy. Yes,
Yes.
good.